So my name is Francoise. I'm a cardiologist at Johns Hopkins. I co-direct the digital health lab at Johns Hopkins as well. And we're so fortunate at Johns Hopkins to be given a gift by the American Heart Association to really build the future of digital health. And so through our AHA Strategic Focused Research Network project, we work across centers from Stanford, from Boston, from all these incredible centers, and we work together to figure out how can we take digital health solutions, like for example, taking cardiac rehab that has often been a center-based opportunity for patients who survived a heart attack or have heart failure to learn the fundamentals of healthy heart life, meaning taking the medications, getting their steps in, and engaging in stress reduction within their everyday life. This life-saving program is usually only in a center or a hospital, but through the American Heart Association's SFRN funding, we've actually been given the chance to create a virtual model. This virtual model is carried out through using a smartphone application and wearables like a smart watch and a blood pressure cuff. That, along with virtual coaching, helps us achieve the goals of what traditionally was done in a center, but now in the comfort of your own home. So we're really hoping through the American Heart Association and our digital health work to be the future of how we can bring heart health to our patients at home. That's an excellent question, and it's important to everything that we do, because our goal is to create a solution that offers heart health for every person, where they are, where they're at, regardless of their educational or social ability to be able to afford technology. And so through the American Heart Association's funding of our SFRN, our center director, Dr. Seth Martin, and myself, Lena Matthews, and Dr. Nina Izakazde, we all collaborate together to try and create a way to deliver and to make accessible digital health tools, whether you're for us, we're in Baltimore, whether you're in Baltimore or you're out in our Elliotsburg community, which is further out in rural areas, and you don't have access to digital health or your Wi-Fi signal is not strong. So what we've done is we've actually created a MTech Center, which is a center that prides itself and focuses on delivering digital solutions with a health equity lens, meaning that whatever we create has to be available for everyone. And the way we start doing that is working in communities that might never have had the opportunity to benefit from digital health technologies. We start to understand what the challenges are, like access to internet, being able to afford devices, understanding how to use smartphone applications when many of us do this on a regular basis. So finding out where people are at, and then creating what we call health tequity, a program where we're figuring out where they are with their technology, we're getting them the onboarding and education experience they need to feel comfortable using these tools, and we're addressing structural challenges to use the tools by working with their communities, by working with novel ways to approach data acquisition and sharing in the technology, like using a SIM card or having a patient download information by going to a Wi-Fi hotspot in a community. So we've really figured out ways to address this, and we're really dedicated to serving everyone, not just a few people. Absolutely. So thank you for asking that. Ultimately, if we want to reach every person, we can't have a one-size-fits-all approach. And we have to accept that patients might even not have technology at all. And so what we created is something called an iShare program. The iShare program actually allows us to share the technology as a loaner device for the use of the program, meaning that no one is left behind whether they have technology or not. That's the first step to making sure that everyone in our community has access to these incredible resources that we know can have a helpful guidance towards a heart-healthy life. Now, say they do have technology, but perhaps they only use it for texting the grandkids or maybe doing a FaceTime here and there. Well, we work on developing a tutorial that is video-based and is also supported by a health coach that helps patients to onboard, get comfortable with the technology, and start to use it. Because ultimately, if we want to reach more patients with heart-healthy health technology, we need to know that they're comfortable in using it and that they have the technology in order to use it. And I think if we reflect on how this could come from a policy standpoint, this is all very new. We're used to meeting patients in the office, giving medications and interventions. But when someone mentions that they might be prescribing you an app or suggesting that you get a smartwatch to help detect AFib or maybe help you get more steps in, this is very new for some patients and for our communities. And we really need a push from a policy standpoint to help get the support that we need to make it sustainable. And by that, I mean to help get an appreciation for these tools as digital therapeutics and interventions that need to be supported by our Center for Medicare and Medicaid, for our payers who see value but haven't quite structured the right payment plan to make these sustainable and successful in our community.